All right, drummers, so we're gonna be talking about posture today, and I've got trainer and drummer Chris. Chris works at Strata Internal Performance. He's also a drummer, so this makes it extremely pragmatic. But we're gonna deep dive into posture and the things that you need to know, the most important things, because there's so much education on posture out there that it can become confusing and murky. So I'm gonna give you some tactical tools and things to think about that are extremely pragmatic, realistic by actually using a person in front of me, and then we'll actually introduce some exercises to help you support your posture if you're struggling with maintaining posture. First and foremost, it's important to recognize that seeing Chris sit here, the word posture itself actually just means position. So most people hear the word posture and they go posture and they think good posture. But if Chris collapses down into a round position, this is a posture. And if he extends all the way up, this is a posture. And what's very interesting is if you go back, there's some interesting literature you can find from several years ago that show all these different postures from chiropractic and spinal textbooks, and they were merely showing the variances in posture that a human can have. Somewhere along the way, the military-grade tall posture became the standard of posture. And truthfully, in one of the textbooks, the normative posture that we use for most posture charts, someone even said of high regard that that posture is nearly impossible to achieve based off of anatomical standards. So we already have very high standards that we're trying to achieve with posture. The other thing that's important is that if we look at a posture, most people look at Chris like this and we go, this is a bad posture. And they look like this and they see someone hyperextended. They go, this is a bad posture. I want to share an idea to you. I don't believe there is a good or bad posture. Really, there is only an increase or decrease in mechanical variables that can make the posture less advantage or better for an individual to perform. The challenge that we have, though, is that some people have orthopedic issues that actually restrict them. And they have, whatever posture they have, that's all they have. I want to introduce an idea to you, and it's this idea called moment arm. Turn towards the camera for me. If Chris is sitting here right now, his torso has a center of mass, and the center of that mass is going right through the base of his support, the drum throne. I know that because if he wasn't, he'd be falling, right? So the center of his mass is going right down to the base of support. You can imagine the center of mass being somewhere in the middle of his body, and there's a line of force going down towards the ground or into the drum throne. Now, if Chris, put your hands across your chest, starts to tilt further over to this side, right at the moment, there is more of Chris on the left side of his hip. And you can actually probably see his right leg start to lift up a little bit. And if we go far enough, he's going to actually tip right over, which I won't let happen. And why that happens is because his mass shifted so far to one extreme of the drum throne that there was not material or a geocentric support there, meaning he was going to fall. Another way you can look at that is that there's an increase in moment arm, which is the distance from the joint axis at a 90-degree angle. So if we have an axis of rotation in the middle of his spine and a point of application to his bum, as he shifts further over, this line of force moves further away from this axis point, making it more likely that he could fall. Now, obviously, we don't want to have that. But it's important to recognize that as we shift our position on the drum throne, things change. Now turn back to the side for me, please. Now, if we think about this idea of moment arm and we think about drumming, even just for a split second, as Chris is sitting here, as I mentioned before, from the side view, the majority of his weight's going straight down. And you can see here that his back is doing whatever it's doing. Now, just for the sake of being drummers, hold those drumsticks out. If you watch right here, take both hands and reach out far in front of you. Okay, come back, bring your hands back in. If you guys actually watch this area of his back, when he reaches his arms out in front of him, Chris has to actually lean back a very small amount to come back to make up for the mass of his arms shifting forward. And that's because the mass of his arms and the drumsticks, he's reaching out so far that it's creating a new moment arm, changing his position a little bit, and he has to lean back to counterbalance that. And this creates a very neat teeter-totter effect between front and back forces. So what becomes very interesting is if we take the drumsticks away, and I actually give Chris something much heavier like a dumbbell, and he holds onto this, grab that with both hands, and reach out in front of you again. You can see here, now he has to lean back even more. You can see now that there's more extension through the spine, forcing him to lean back. Why this is important is that the postures that we have while we're playing the drums are extremely dynamic based off of the positions that we're playing in. We also have to consider the anatomical components to figure out, as we're playing, is there an increase or decrease in load in specific areas? So with Chris sitting here right now, if you guys have looked at any sort of anatomy before, what we know is that Chris sitting in this position, he has different parts of his spine. We have these two pelvis bones, the innominate on both sides. We have the sacrum right in the middle, and then you have these different segments of the spine. We have the lumbar spine, the thoracic spine, and the cervical spine. And we can get to the skull, but we're not going to talk about that necessarily too much today. What's very interesting is if you think about the lumbar spine, when we perform trunk rotation, a lot of the trunk rotation that we experience as drummers, there seems to be quite a bit that happens in the lumbar spine, although we do get some in the thoracic spine. What ends up happening in the lumbar spine, what's very interesting, is that these actual facets, these little joints in the back here, they actually don't turn so well. So when I actually take these facets and I rotate them, in the neutral position, they have anywhere between 1 and 3 degrees of rotation from one side to the other. So if I take Chris and I put hands across his chest, and I make Chris trunk rotate to the left side, so you can see how far he can turn, right? It's got about 45 degrees of motion. Same thing the other way. This is great. Now, if I make Chris extend his spine and go really tall, and I have him turn to the left again, the amount of rotation he experiences decreases dramatically because those little bones do the same thing the other way. These little bones are actually going into full extension and bumping into the bony barriers at the end. And if I do the exact opposite, where I go into full spinal flexion, right, those little articular facets are now opening up, and if he rotates, he's actually going to have a little bit more motion. It's going to look a little different because it's coming from the rib cage, same thing the other way. Good, he's even got a little bit more there, which brings up a whole other series of conversations. So ultimately, if we are in a different posture, how we move will absolutely be starting to change a little bit. Now, the neat thing about all of this is that understanding this thing called active range of motion, our ability to move however far our body will let us go, will give us a good framework to figure out where we should place the instruments. So right off the bat, if Chris is sitting here in this normal looking posture, if he put his hands, you just hold your hands kind of like out in front, but like that, like you're holding drumsticks, right? If we were trying to figure out where we should put instruments, if we turn him from left to right without his shoulders moving too much, this gives us a very simple framework to figure out where's a really comfortable zone for us to play drums, right? Was that Floor Tom? That's right. And so this gives us what I would call the window of opportunity, right? This very comfortable window where Chris could set up his instruments pretty easily. The thing that's important to recognize that's much easier to see in a skeleton, actually Chris, face towards the camera, is that every bit of control that we can build in our spine, or let's start with that, every bit of control we can build in our spine will actually help every part of the segment. So if I actually take the lumbar spine and I side bend it just a little, so you can see I'm just moving the one part of the skeleton, right? You can see the whole skeleton shifts over. And so when you see someone and they're sitting a little bit like this, right, it's very easy to go, I want you to correct that posture and pull them back. But we don't actually know what's causing that. They could have an orthopedic issue. They could have a muscular imbalance. They could have a disease. There's so many variables going on there. It's really, really tough to know exactly what to do. But what we can do is figure out what feels good and what doesn't feel good, which we're going to get into this fun idea that I'll call neuroplasticity in a second. So I learned this from one of my mentors, because if you think about the complexities of posture, we can go really deep with this. But here's what I want you to think about when you're trying to figure out where should you place your body from a postural perspective. Turn facing back this way. 1, when possible, if it's comfortable, you want to try to make sure that the majority of your thorax is over top of your hips. Thinking about that idea of moment arm is if Chris leans forward, more of his torso will be forward over top of his hips, which increases that moment arm, which means this is going to be more work for him. Less ergonomical, inefficient, because all these muscles now have an increase to torque and they have to work at a higher level. If we do the exact opposite, where he leans backwards to whatever degree he feels comfortable, this also increases the moment arm the other direction, which means all the flexors of the body are working to make sure he doesn't fall back. So trying to be, when possible, in this position where your thorax is over top of your hips is efficient because these muscles are not working too hard and these muscles are not working that hard. Now, I've had some people in the past ask me, well, what's the problem if I am leaning one direction a little bit? I'll show you. There's something called intention-based resistance. And so if Chris performs, put your hands across your chest, here, face the camera actually. If Chris performs the exact same trunk rotation I showed you a moment ago, boom, and boom, okay? He's able to achieve this because bone is not getting in the way, and it's a summation of his current strength. Now, if I say, Chris, I want you to squeeze your glutes as absolutely hard as you can, right? You can see him get a little taller. He's actually lifted up like an inch because the muscles contract and push him up. Don't lose that contraction, and now try and turn to the left. And now try and turn to the right. Good. There is a tension-based relationship because of something called biomotor configurationalism, or you call it myokinetic interdependencies, is that when he squeezes his glutes, they pull on his lower back muscles and his lats and everything else. And because there's so much tension in here, he actually loses the ability to achieve full range of motion because he's getting to the end of something called the strength curve sooner. All that gobbledygook means if you're working too hard in one area, it will absolutely affect other areas. So from an efficiency perspective, we want to try and decrease that. And you can see that. Put your hands across your chest, turn to the left. Good, come back. Squeeze your bum, turn to the left. Instantly decreasing just by contracting his glutes. Turn over to the other side. Sorry, turn and face away from us. So this comes back to the same idea that when we're trying to make sure he's not working that hard, we want to try and decrease the load here as best we possibly can. So from the sagittal plane front to back, one thing that you can do, put your hands across your chest. Collapse your spine down as far as you can. Great. Come back and go into full spinal extension. Good. Relax. Now try and find this place in the middle that feels kind of comfortable and relaxed. Perfect. And you can see Chris is coming back to the same place where his thorax is over top of his hips. This is fantastic. Now, if you are someone who does struggle with posture and you have kind of got this collapsed posture, there can be one of two reasons this happens. Over time, this can become anatomy, or it could be hereditary because of family reasons. In some cases, we can't push this much further. But one of the best ways to change posture outside of strengthening, like we're going to do a little bit today right here with one dumbbell, is thinking about this idea of neuroplasticity. Now that's a huge sentence. Sit up nice and tall for a second. But neuroplasticity is basically our brains and our body's ability to change itself. If our body has the ability to change itself, there are three different simple things I want you to think about with neuroplasticity. Now there's lots of different types of plasticity, but in the neuroplasticity realm, there's long-term potentiation, long-term depression, and neurogenesis. And what's very cool is if Chris has this collapsed posture, if you look up the myriad of reasons that someone could have a collapsed posture, you will find everything from disease, hereditary, degenerative disease, self-esteem, muscular imbalances and weaknesses. The list goes on and on. One of the simplest ways to correct your posture is to merely start thinking about it more. And how I like to think about it is I would encourage you to think about bringing your chest up. And this is a really cheesy demonstrative example, but I think about high school bullies. And if you're thinking about someone, you want to improve your posture, if someone grabbed your shirt and pulled you up by the collar like they were pulling you up on a locker, that instantly pulls your chest up. What most people have a tendency to do, and you know what I'm going to ask you to do, Chris, is you say, hey, chin up. And they bring their head up, lordotic neck posture and kyphotic thoracic posture, which really, put your hands across your chest, try and trunk rotate from there, does not feel very good. So I want you to think about if you want to improve your posture outside of the motion assessment I showed you, is imagine there's a bully pulling your chest up. You're wearing a necklace, someone's pulling the necklace up. Now how you do this, you want to do this just enough that you feel some tension in this area, small amount, but not enough that it's exhausting. Now if you're like, well listen, I'm not at the drum set enough times to be thinking about this, or I don't want my entire practice session to be about posture, that's no problem. A very simple thing you can do outside of going to a gym is go, I want to improve my posture, I'm thinking chest up. I would tell you bring your drum throne down in front of the television or outside in the backyard if you're having a barbecue, and sit there for 20, 30 minutes or an hour just like this, and just sit with a but a tall posture. And over time, because of that long-term potentiation side effect of neuroplasticity, these muscles will increase in their potentiation. They will be contracting more, and things that were pulling you down potentially could depress and relax, depress in a good way. And over time, if you do this enough, the posture will become permanent. And that's very cool. So one of the best ways to improve your posture, honestly, without trying to make this oversimplified, is to think about it. Be aware of it. Come back and face towards the camera for a second. Now, as I mentioned before, I showed you that trunk rotation thing. We did the front to back posture. Another quick example is just so you can get an idea for yourself, is put your hands across your chest, is if you want to just see where you're at, place your feet down on the ground or on your pedals at the drum set and turn from left to right. And just make sure everything feels good. While you're doing this, what I'd encourage you to think about doing, it's a little silly, hold that in the middle there like you got an arrow coming out of your chest, is if you do this, turn to left and right, try and see, are there instruments underneath your drumstick as you turn? And if there's stuff like you've got a China cymbal way over here, that brings up a whole pile of conversations of, do we really need that China cymbal over there if you're going to be playing it a lot? But I would encourage you to do the trunk rotation to see how this feels, and you'll see why a little bit more in a moment. The other side of his hands across your chest, and we're going to do some frontal plane, and you're going to do side bends like so, and then come back and see how everything feels. Perfect. Now, before we actually start strengthening the posture, I want to address two more things. Turn away for a second. If you're sitting on your drum throne, you want to make sure that everything, your hips and your chest, are right over the middle of the drum throne. This ensures that you have an extremely sturdy base. One of the best ways that you can make sure that you're in the right spot is do what I would call a bit of a balance posture test. And I've never done this with Chris, so it'll be kind of interesting to see how we do. The very first thing is I wanted to see if he's sitting here, can you lift up the one leg in the hip flexion without leaning back? Good, and then do the same thing to the other side. Good. Now, Chris, what I want you to try and do is you're going to stay seated on the throne, and I want to try and lift your feet underneath your bum, so you're going to be balancing on the drum throne with your feet underneath. So you're going to pull your feet underneath you. Good, and try to, can you hold them up? Chris is pretty tall. Good, perfect. So this, right now, you can see Chris's toes are not touching the ground. His feet are right underneath him. His midsection is forced to be engaged to some degree, so he's got this great posture. You're not working too hard here, are you? Nope. Good. And so this is exactly where he wants to be sitting on the drum throne because everything is right underneath his feet, which is great. This is showing me his center of mass is over his base of support. Now, go back to that spot for a second. Now, let's say you're a very active foot player. You play double bass, you want to play Terry Bozzio multi-pedal stuff where your feet are always going. What I would encourage you to do, this one's a bit tougher, we'll see if Chris can do it. Bring your knees up a little if you can. Both of them. Yeah, he's having a hard, okay. Okay, now what I want you to try and see, how far can you straighten your feet in front of you before you, okay. No, like you were in bed, like on bass drum pedal. So bring your feet underneath you, right, and then just bring them out a little bit. There. But you're going to be holding them up still. Let's try that. Yeah, slowly bring them forward a little. Good. Good, and then come back and relax. So this, for me, tells me that for Chris, we got to work on the core strength a little bit if he was going to be starting to play double bass a little bit more or at a greater intensity, which he has no desire of right now. More of a drum and bass player, which is totally cool. But at the same time, we need to make sure that for someone who is playing double bass or busy feet, that their leg weight is not a factor. As you saw with him, Chris's length and weight was enough that he had to lean back. So an easy way to overcompensate for this is to build the strength in the front here. An easy way to get started, let's say we were going to actually do that. Like if you have the exact same thing that Chris just showed, pull your feet underneath you again. Okay, we've already seen that Chris is pretty good here. Now, as a very simple exercise that we can get started with, very simple to start working on posture. Everything here is stable. Don't let your feet touch the ground. Try and slowly bring this knee up to my chest without leaning back, and then come back. And do the same thing on the other side. Good. So all he's doing is very controlled hip flexion while not leaning back and maintaining the posture that he wants to sit in. This is doing two things. It's engaging all of his hip flexors and abdominal muscles involved with maintaining this posture. Also, making these muscles have to work as stabilizers to provide a strong anchor for him to do this, which is great. How do you feel? Excellent. Cool. So we've got some basic exercise. We've talked about posture. We talked about changing a center of mass. We talked about neuroplasticity. This gives a lot of really great stuff to get started with. Now, let's say you've heard all this and you're like, okay, well, I want to see what I can do with my posture as far as exercising goes. I will say this, having access to an entire gym, like we're at Strata in Newmarket, Ontario. This is my gym and Chris works here. I mean, this is an awesome team here. 4,000 square foot of great gym stuff. I mean, if you have access to a gym, I'd encourage you to go. But let's say you don't. Most of us will have access to a dumbbell. And I want to show you some very basic exercises that I literally made up today to try and support posture. Face towards the camera for me there, Chris. If we're thinking about posture, there's a few areas that people will struggle with. Most of the time when someone talks to me about having issues with their posture and affecting their drumming, they talk about discomfort in the lower back, or they talk about discomfort in the front of the hip. So what we can do is we can try to sectionalize those range of motion assessments I showed you earlier and develop exercises. Now, I'm going to say this very frankly if anyone here has an exercise background. The exercises I'm about to demonstrate are not the perfect exercises for these muscle groups. In fact, I think for all of them, there are far better ways to actually work on developing these muscles. But to get started, what I'm going to have Chris do is I'm going to have him grab this dumbbell. You're going to hold a lateral raise, okay? And now at 10 pounds, Chris is going to hold this at 90 degrees for a few seconds. I'm not going to make him work that hard. But while we're here, if Chris holds this for as long as he can, all of the oblique muscles on this side have to contract to make sure that he's holding this thing still. And so a very good exercise that will actually help his cymbal playing and obliques on the opposite side is holding this dumbbell to the side for as long as he can. And a very simple strategy is holding the one arm for 30 seconds and then taking the dumbbell on the other side and doing the exact same thing, reaching up and holding that for 30 seconds, and now the oblique on this side is working. He can easily go back and forth. Now this is a brand new exercise for you, and what's very interesting, I can see he's much stronger in this one because the other one he was shaking a little bit more. This allows you to work on imbalances from left to right in your back, which is very cool. In most cases, when I'm working with people who have chronic backaches, exercises like this in the frontal plane are extremely, extremely powerful tools. Now another one that you can do, which for someone like Chris won't be enough resistance, is you can just grab the dumbbell, bring your feet nice and close together, put the dumbbell hanging. One thing that you can do is you can actually work on side bending over, so side bend over to the right side as far as you feel comfortable, good, and doing small motions coming back. Now 10 pounds won't be enough for someone of Chris's size and proportion because Chris is quite strong, but for you, if you have a 40-pound dumbbell, you can do these small side bends and actually work on all these muscles underneath the rib cage in a really, really great way. Perfect. Feel okay? So we've got 2 frontal plane exercises that we can do. Now face sideways to the camera. Now another one is we talked about sitting outside and actually just sitting in the posture that you want to perform in, right? Actually working with this habit. Really simple thing you can do is grab this dumbbell with both hands. And so small reps is don't let your posture lean back and slowly reach that dumbbell out like we did as the assessment, and then come back in. This in itself, again, very simple exercise, but as Chris reaches out, all of his spinal erectors are increasing in how much they're contracting. And so this is a simple one that you can do, and I would encourage you, if you've got 10 pounds, don't go for how many reps, go for time. Can you do it for 30 seconds? Can you do it for 60 seconds? Can you do it for 3 minutes? And then increase the resistance. It is a great shoulder exercise, and the biceps are also involved as well, but these lower back muscles have to work to a great pedigree to make sure he's maintaining this position. If you perform this exercise, I will say, focus on the posture because that's what we're talking about today. Make sure you're thinking tall chest the entire time. Now, that felt okay for you? Yep. Perfect. Now, turn back to the camera for me, please. The next thing I want to have him do is actually do a trunk rotation exercise. Now, I'm going to be honest, with a dumbbell, this is not a fantastic option, but it's a really accessible one, which is why I'm going to show it to you. Now, what we'll do, grab that. You're going to hold your arms out in front of you. One thing that you can do is you can side bend slightly, and while you're side bent, perform trunk rotation from the side bent position, and you're going to feel the lengthened side muscles work. So turn all the way down and then come just to my hand. Truthfully, control is the name of the game here with exercises like this. But one thing that's extremely simple to do, if you really want to get diverse with the tool set you have, is bring your hands up in front, grab the band, is setting up an elastic band perpendicular to your body and actually performing banded trunk rotation. Again, when you're doing this, make sure that posture is your primary goal and you're thinking tall, and for the sake of drumming, starting off, I would be thinking more about time rather than how many reps. Feeling okay? Great. Awesome. Now, for lower back exercises, this is going to be a little bit of a weirder one, and I'm going to be honest, I demonstrated this on a live on Instagram recently. I don't even know if Chris has actually done this before, which is going to be kind of fun. Can you stand up? And I want you to stand with your chest over top of the drum throne. So come on over here. So you're going to come over here with your feet there. And I want you to hinge, hip hinge, like you're doing a deadlift and your chest is over top of the throne there. Good, come up a little higher. Good, and all I want you to do is put your hands across your chest. So you're in this position like you're doing a deadlift or a bending over, and I want you to rounding down and extending just around my arm, not changing at the hips. There we go, good. Perfect, collapse back down. Now, again, I've never made Chris actually do this exercise, but this is a full body weight lower back exercise where it takes a second to get the positioning where the hips and the lumbar spine are not moving, but he's actually going through thoracic extension and flexion, and you can probably feel all this, right? Yeah, good. So this is a great one because it actually focuses on those thoracic spine muscles in a bit of a different way, which is very cool. Last exercise I'll show you, sit back down and face away from the side view to the camera. Another simple one that you can do, just to get another drum throne one, is I showed you the reaching out with the dumbbell. Place your hands across your chest. I want you to lean back, keep your feet flat as far as you can before you feel like you're going to fall. and there's a point, right, like a balance point where his feet like they're gonna come off. So right here, if he's maintaining that contraction, this becomes a really, really great abdominal exercise, and then come back forward nice and slow. You could call it a much more drum-specific plank. If you're really nerdy about anatomy, you can do this one of two ways. You can either do it just from the rib cage, so he's actually extending back like he was doing, so there's much more curvature in the spine here. The other one is I want you to keep your back completely straight and just do it all from the hips. Yeah, hips. You can keep the spine completely straight and hold it just from the hips, which becomes a little bit more hip flexor and abdominal based. Both are really, really fantastic options. If you want it turned towards the camera, if you really want to take all this to the next level, what I would encourage you to do is actually place yourself at the drum set and have instruments placed around you. And the reason why is that there's an amount of forced geometry that is forced upon you based on, like this is a standard 14-inch wide snare drum. And these DW drums with the turret lugs are even a little bit wider, probably about 15.5 inches. That means Chris has to have his feet wider, and this could actually change how he moves. So in short for today, I'm hoping this quick lesson on posture gets you thinking about things a little differently. There are so many components to getting into the biomechanics of posture and articular facet mechanics that we can dive into, but if we're really thinking about drummers, here's the most important thing. We need to make sure that we're operating from a solid position in a way that we can lift our feet up like I showed you before, like I showed you with Chris, and yours, because he's 6'2", right? Taller than I am, 5'10", right? For him, if he brings his feet in front of him, he has to lean back, which is a problem that some drummers have. So that gives us a great opportunity to build the strength there in a very pragmatic way. All the exercises with the dumbbells and the bands give you simple exercises to actually start working on this posture. But the most important thing to remember is that if you Google search how to improve posture or what leads to posture not being good, there is a huge list of medical disease reasons, but then also emotional-based reasons. Insecurity, confidence, all that makes a huge difference. All we need to know is that if we are in the most optimal position for us, the risks of having poor posture decrease dramatically. It decreases the workload on us. The real reality is that posture is just one component of ergonomics, right? It's the egocentric side of things, making sure that the midsection is out of the way, that when Chris moves his appendages to create art, he can. And if you're in a position where he's collapsed down and working way harder on these muscles, just like Buddy Rich, he'll still be able to play the drums. But from an ergonomics perspective, and I mean that as a synonym to efficiency, this is less efficient. And over time, there's something called Wolff's Law. Come sit up. And Wolff's Law describes that your anatomy can change shape up to 10% each year based off the positions that you perform in. The position that you perform in can become permanent. So if you think about good posture, and let's say you've got really horrific posture now, you practice being taller. For the first 5 years, it may not be a huge difference, but you keep working at it, you can get as tall as Chris. If you keep hanging out in this collapse position because you're an artist and you're like, I want to feel everything, and you collapse down, that's fine, but this will also become permanent over time. Lastly, the stronger you can get, the better. The exercises I showed you today are introductory exercises, but I would encourage all of you, if we're really thinking about health span versus lifespan. Chris could live to be 100 years old, but truthfully, can't move his body past the age of 85, and this is a common thing. Now, we're not talking about lifespan, health span for you, I'm talking about drum span. All of this comes down to basic changes that you can make today so you can continue playing drums until the last day of your life, in my opinion. And that comes to making sure that you have all the motor pieces that you require and all of the body is not getting in the way. There's no injuries, there's no pains, there's no arthritis, so you can continue to do what you love. But that's going to be our class on posture today. Chris, thanks so much for being here. Fellow drummer, trainer, everyone, let me know if you have any questions. If you're new to the channel, please like and subscribe. If you want to talk more about posture, we can go deeper into biomechanics. But thanks so much for being here. Stronger drummers play longer. I'll see you guys soon.